Hello, I am Kim Carter, Director of Environmental Health and Safety with Hygieneering. Welcome to this brief webinar that is dedicated to understanding employer requirements under the OSHA Respiratory Protection Standard in light of COVID-19. Because of this pandemic, so many more employees are wearing respiratory protection. For some, it is a new mandatory requirement by their employer to wear a respirator for specific tasks. For others, it is on a voluntary basis, just for their own level of protection and comfort. In either case, there are OSHA regulatory requirements that must be followed. This session is designed to help employers understand what they are required to do in terms of a written respiratory protection program. Do you need one? Do workers need training? Are medical evaluations required? Who is required to have one prior to wearing a respirator? And what does the medical evaluation consist of? And finally, what is fit testing and how is it conducted? The Occupational Safety and Health Administration, or OSHA, has a respiratory protection standard, which may be found under 29 CFR 1910.134. These questions are the origin of why we decided to do this webinar, so that whether you are from a school district with teachers that have new responsibilities due to COVID-19, or you are from another type of workplace with cleaning staff using new disinfectants that may require respiratory protection, we hope that you find this information helpful. So let's go ahead and get started. First off, just so that we are all on the same page here, we are talking about the employer requirements under the Occupational Safety and Health Administration's Respiratory Protection Standard. Determining whether respiratory protection is mandatory or required or voluntary will dictate the steps that you need to take as an employer. Let's review an example, such as a school district. Because of COVID-19, many school districts have identified certain occupations, such as nursing and other staff, that are required to wear an N95 filtering face piece respirator while addressing the medical needs of a potentially infected student or staff member. Or, because of the new types of cleaners or disinfectants used because of COVID-19, your maintenance or cleaning staff is now required to wear a negative pressure half-face cartridge style respirator because of the cleaner they're using. These examples would fall under the required category. On the other hand, if a school makes N95 respirators available for teachers and staff to wear while working with children that may not always wear their face covering properly or follow social distancing guidelines, this scenario is considered voluntary usage. The school district is not requiring the respirator in this case, but they are providing the teachers with these respirators on a voluntary basis that they may choose to wear for personal comfort or protection. So in terms of OSHA regulatory compliance, what are the differences between having respirators that are required or respirators that are used on a voluntary basis? First, we will talk about when respirators are required. If you require respirators, whether it is a filtering face piece N95 type respirator or a cartridge style half mask respirator, you as the employer are required to have a written respiratory protection program. All employees required to wear a respirator must complete the medical questionnaire. All employees required to wear the respirator must also complete annual training and annual fit testing. Where respirators are used on a voluntary basis, different OSHA requirements may apply. If you allow employees to voluntarily wear a filtering face piece N95 respirator, the only OSHA requirement that would apply is that the employee receives a copy of Appendix D from the OSHA Respiratory Protection Standard. If you allow employees to wear a cartridge style half mask respirator on a voluntary basis, you are required to have a partial written program. The employee wearing the cartridge style respirator would be required to receive training, go through the medical questionnaire, and receive Appendix D from the OSHA Respiratory Protection Standard. So let's briefly cover each of the different major compliance elements. The written program is exactly that. It is a program that identifies the specifics of your program in place at your facility. It would define who the program administrator is, the type of respirators being used and why they're being used. It would discuss employee training, the details of your medical evaluation program, program documentation or how records are being kept, and much more. The medical evaluation. The medical evaluation is required by OSHA because using a respirator may place a physiological burden on employees, and therefore OSHA requires this medical evaluation before respirator use. There is a brief questionnaire that needs to be completed by the user prior to putting on a respirator. The medical questionnaire is then reviewed by a licensed healthcare professional. For folks with no medical pre-existing conditions, that's usually it. They would be approved to get a fit test once their medical questionnaire is reviewed. But for some with medical conditions that wearing a respirator may cause an issue, further evaluation by a physician may be advised. It's usually in the form of a physical exam and a spirometry test. After all appropriate follow-up, the physician would provide a thumbs up or thumbs down for the fit test. Fit testing is the mechanism by which we ensure that the respirator is fitted properly and effective. Most commonly, it is done on a qualitative basis, where a challenge atmosphere is provided and the user evaluates whether or not there is a good fit. It is typically conducted with a non-hazardous, very bitter substance, or sometimes a substance with a strong smell to it, such as banana oil. There is a formal process of several movements that the person has to do while wearing the respirator under the challenge atmosphere. This process of fit testing must be completed and signed off on in the form of a fit test certificate. And then training. Training for staff required to don respirators will vary based on the type of respiratory protection they are using. Suffice it to say, filtering face piece respiratory protection training, like an N95, is relatively brief. However, cartridge respirator training is typically conducted with a classroom portion and a hands-on portion so that the user understands how to properly use this type of respirator. In summary, there is a lot to the OSHA Respiratory Protection Standard, especially if this is the first time that you are requiring employees to don respirators. Hygieneering has been assisting clients with respiratory protection program elements for many years. Please feel free to contact me directly to discuss your particular situation or if we may be of assistance in any way. My contact information is right here on the screen. Thank you so much for your time, and we hope that you have enjoyed this brief informational webinar on OSHA's Respiratory Protection Standard for new users due to coronavirus. Thank you.